This is the pelvis of a 35 years old Paris female in reproductive age. You are seeing the transverse section of the uterus and is surrounded by fluid. This is the uterus in transverse section. This is the endometrial canal. It measures 4.3 centimeters and is surrounded by ascitic fluid. This is the longitudinal section of the uterus. This is the longitudinal section measuring 7.2 by 3.6 centimeters. This is the urinary bladder and this is the ascites. This is the ascitic fluid and this area appears bright because of reverberation artifacts. Otherwise this is a clear fluid. Now this is the endometrial canal, central, clear, no focally seen. Now when I move the probe towards the right adnexa, I see a mass complex with echogenic mass with internal cystic areas, and it extends into up to the right lower abdominal quadrant. You can see that or otherwise I can also report it in a way that there is a mass echogenic at the periphery with cystic elements seen in the center and along the posterior margin. Now this is the central cystic area, fluid filled area. These are the posterior wall fluid filled areas where you can see strong back wall because of this fluid, and this is the echogenic part. These bright echoes are the echogenic part of this mass, which measures approximately 10 by 6 centimeters, 10 by 6 centimeters. Here we see, now this is the uterus, this is the urinary bladder, and this is the boundary of the mass. This is the outer margin, medius, lower, and cystic area. No significant posterior wall acoustic enhancement is seen at places, but in general there is consistently posterior wall acoustic enhancement is because of this fluid part within this solid element. There is a solid mass, complex mass, and which is not only in the central region but can also be seen at the periphery. This is the posterior wall of this mass, and here we see posterior wall enhancement. There is no calcification so far seen. So the tubular shape, echogenic mass with internal cystic area and no calcification seen, extending from the region of the right adnexa up to the lower abdominal quadrant, and this is the main pathology that we come across. Uterus is otherwise normal, and the ascites is because of chronic liver disease, cirrhotic liver, Now this is the liver, shows chronic liver primal changes. Outer surface is yet smooth, not that irregular that we see in cirrhotic liver. So this is early stage of cirrhosis. This is the portal vein. No evidence of para-aortic plan adenopathy. Kidney, spleen is normal. However, there is fluid in the Morrison's pouch as well as the paracolic gutters, both paracolic gutters. This is the one that will come across, and this is the fluid in the left paracolic gutter. These are the iliac vessels. On the left side, and on this side you do see ascitic fluid. Now this is the ascitic fluid, not the urinary bladder. This is the urinary bladder and this is the ascitic fluid. And here you can see impression of two major organs. One, this is the urinary bladder. Sorry for the cough. This is the uterus. This is the endometrial canal, and this is the mass. And this is the posterior wall enhancement from it. This is small amount of fluid seen in this location. This is also echo-filled fluid seen in the pelvic cavity. This is the case of the day. Thank you.